When I first started using drugs or alcohol, I would have to say I was 16 years old. The amount of alcohol that I would use once I started, I'd start off with a pint, half a pint, work my way up to a quart. I've never got anything like a 12-pack or anything. I usually start off with like an 18 pack. So my life started falling apart as a teenager from my addiction to alcohol. Not thinking clearly, making poor choices, not going to school, getting into trouble with law enforcement. I wanted to use alcohol, that was it. That was the whole story. I mean, it didn't matter what my mom said or who else said, I was addicted to alcohol. And that totally just changed and ruined my life. Before starting the program, my drug of choice is methamphetamines. I've done that for at least a half a decade. It took away all the things that I've loved most. My mother-in-law and father-in-law at the time, they knew exactly something was wrong. And that actually destroyed that relationship with all of them.
Coconino County DUI Drug Court was established in 2001 and had its first participants graduate in 2002. The court is based upon the 10 key components of the drug court model. The court includes intensive outpatient treatment, support group meetings, random urine screening, intensive probation monitoring, and frequent court appearances.
FMC Behavioral Health has been doing a CDIOP program for over 20 years. That program traditionally has been group-based psychotherapy with a family component. The new program is based on adding a wellness portion to it.
When Flagstaff Medical Center Behavioral Health assumed the role of provider to the Coconino County DUI Drug Court in March of 2012, we aimed for something bigger than sobriety, a life of wellness that included sobriety.
Well, the first is exercise, and we do supervised exercise at our FMC cardiac rehab gym. And the goal is to transition them then to our YMCA program, our community partner, and that is for sustainability reasons. These people often are undereducated and don't have a whole lot of money, so we're providing them an opportunity to exercise that they wouldn't be able to do themselves.
The first main component is fitness and physical exercise, and really providing a consistent area location for the clients for the 9 months to have a home, a location here at the YMCA.
I was pretty excited. Once they showed us around, I was like, no way, we're actually going to come here and work out. I'd be able to use the treadmill, use some of the free weights, and take advantage of the basketball court. Prior to that, I was just home and work, but being able to throw that into my daily routine, awesome. I couldn't ask for more.
We realized early in the development of the wellness program that some of our clients may have health conditions that would make it unsafe for them to participate in exercise. This led quickly to the realization that many of them do not have easy or affordable access to basic health care. Through developing collaborations, partnerships with local outpatient, community-based healthcare facilities, we were able to connect these clients with primary care physicians. We think it's this integration of behavioral health and physical health that may in fact be an important ingredient in the outcome and the success of our clients in chemical dependency treatment. And this is really very much in keeping with the core mission of Flagstaff Medical Center, which is to improve the health of individuals and the communities that we serve.
The second is group educational sessions on nutrition and their dietary needs. And then we polish it off. We go even so far as to a field trip to a grocery store, and we help these patients go through and make good, healthy choices on a recovery diet.
I would just eat anything, buy anything. When the nutritionist from the hospital would come to our groups and taught us about healthy diet, how it can help us in recovery, it has blown me away. The knowledge that she has given to me. Learning cool things about how to read the back of a cereal box, milk, different types of products that you could find in the store, like exactly how many sugars, calories. I've learned how to plan meals in advance and how to shop for, basically just to stay away from the inside of the store, but mainly shop at the outside, like around.
The third item is the training in meditation and mindfulness. And this is really going back to the core of who they are and trying to make good decisions rather than using drugs to relax and calm them.
The other two components really focus around the pro-social environment that supports a client through the program. One being the family membership, that any two adults or members that live at a household have access through to the YMCA. And the other one is the environment interacting and supported by the members and the staff here at the Y. We've seen a lot of the clients get involved as either volunteers or go into different programs such as adult basketball and really engage not just with their change, but also with changing the community around them.
There's like 5 of us of the DUI drug court members. For 2 months we put in like very hard work of running up and down with different teams, and we were able to walk away with a basketball championship, a 5-on-5 basketball championship. I mean, phenomenal. You guys didn't offer this, you know, the 5 of us wouldn't have been able to experience something like that. I was accepted into the program the end of March, and I actually graduated beginning of February. The difference it made in my life is how to be aware of, you know, your feeling. I used to throw that away, you know, feeling ashamed of certain things, and, you know, being able to, you know, change my perception just about it at any time. My life today, if I hadn't got accepted into the DUI drug court, would probably be me still suffering from my addiction, or maybe 4.5 to 8 years in the Department of Correction. Before the program, I would handle stress by using alcohol and marijuana. But now I handle it by self-awareness, daily inventory, and breathing. Try to fit in my meditation also as well, but usually my meditation would be half an hour on the treadmill or an elliptical or some type of cardio. That's how I handle it now. One thing that stuck with me, I forget who said it, but, you know, she said, you're not going to go onto a beach and, you know, expect a suntanning lotion in a bottle just to stay right there and being able to, you know, help you out. You have to apply that in order for it to work. That, for some reason, actually stuck into my head. The program has given me an opportunity to change my perception in life, the direction that I'm going in. 5 months ago, I've moved up as a supervisor, being able to work in different departments, and, you know, I have different skills, so I'm very valuable that way. I am sober. Tomorrow I will have 19 months. My new addiction is jiu-jitsu. You know, I go 3 to 4 days without it. I'm like getting antsy in my pants, like, oh, I need to, you know, I need to get my butt back in there. Physically, I've lost 20 pounds, best shape of my life. I am continuing with school for hotel and restaurant management. I haven't got the official letter yet, but I've gotten various emails. I'm actually working at my relationship, being able to rebuild everything that I've thrown away, like my trust, you know, being able to talk with my kids, and, you know, being able to build that friendship back up. It's a little difficult right now, but you know, I know it's going to get better soon.
Well, what it's really meant to the YMCA is really supporting community change and positive community change.
I like that the Flagstaff Medical Center program helps our participants to become more healthy, more well, so that they can have better tools to maintain their sobriety for life.
The CDIOP program with the wellness component is the only way to go about doing this.
I would like to say thank you very much. I mean, to the bottom of my heart. I mean, this has changed my life.